One of the things that you learn in advanced prosthodontics is about jaw movements and about how the teeth fit together and about clenching and grinding and how to minimize that. And for years, we would put every case that we did, whether it was fillings or whether it was a full mouth reconstruction, we would put them in a bruxing, a night guard, something that would keep them from causing force damage on their teeth over time. And just that one putting in, I call it a Teflon slider that fits comfortably, that is adjusted so that you can't put more pressure on the teeth. It minimizes the loading of the teeth in your sleep. And we did that for 35 years. As a matter of fact, that's what I've lectured on and written on for years. And we went from an upper to a lower to an upper to an upper. Those arguments would prevail for the day. And for the last 15 years, we've realized that we were just treating a symptom. The clenching and the grinding and the loading of teeth was really a survival mechanism that was just telling us that during sleep, somebody wasn't ventilating properly. And so if their throat closes or their nose doesn't ventilate, their brainstem wakes them up. Emergency 911 when their oxygen level drops in their bloodstream. Their heart rate goes up and their oxygen level goes down and their heart rate goes up. And so you can monitor people in their sleep with a very simple finger pulse oximetry high resolution recorder. And it will tell us how many times in their sleep their oxygen level is dropping and their heart rate is spiking. And most people, you would think when they're asleep, their heart rate would be the lowest because they're not doing anything. And we can get someone's resting heart rate and we can see them spiking 20, 30, 40 points above their resting heart rate. Some people are doing this 20 to 40 times an hour. We've had patients that were 80 times an hour. They were desaturating. And these are generally obese people, and the conventional wisdom is their obesity caused their problem, and you flip that around, their breathing and their sleep caused their weight gain. And so it's a chicken egg thing, and obviously losing weight and clearing up their airway issues make teeth survive longer. And so that's where the airway, the bruxing, the snoring, all the sleep medicine intervention that dentistry is doing comes from, is we're saying that it's a nasal underdevelopment because of lack of nursing and chewing hard foods. It's cultural, it's dietary, it's Western civilization that's causing crowding of teeth, underdevelopment of the arches, no room for wisdom teeth, and the necessity of ortho to make your smile look good. Well, we're just treating symptoms that are related to airway ventilation in your sleep.